We're doing patient-centered outcome research both within the Arthritis Center as well as across the Division of Rheumatology. We're working with our colleagues in the Scleroderma Center, for instance, to understand more about living with interstitial lung disease, or the lung disease that can often accompany scleroderma. How do the symptoms in the lung relate to the symptoms that people are having in their skin and in their joints, for instance? How can we ask about those to understand the differences between those two? We've also been working with our colleagues in the Myositis Center to ask people with inflammatory muscle disease how they experience their illness. Because to date, we really haven't had a good questionnaire to even ask about those types of symptoms. So these researchers are also doing qualitative work, asking patients how they experience their disease and what we need to measure and do better. Similarly, we have research that's going on in the psoriatic arthritis arena, where we're trying to understand how patients experience that condition, which links both joint complaints as well as skin complaints. We need to understand which of the two are most important for people. Which do we need to be asking you about if you have both of these conditions? How can we get that information so that we can then find tailored treatment that's important for you? We really think that this focus on patient-centered outcome research is going to change how we deal with people. We're going to see patients not as their diseases, but really as a person on the other side. And we're going to have methods to be able to quantify or help to classify people into different groups. One of the things we found with our research in terms of bringing patient-reported outcomes into the clinical care setting is that having that information fosters communication. It helps patients and physicians to talk better to one another. It helps patients to identify the symptoms that they're actually experiencing, and it gives a starting point for the conversation with the doctor about what's important. Our doctors have told us that that type of information helps them to know their patients better and really also facilitates the conversation. And our patients have said things like, gosh, I didn't even realize that my rheumatoid arthritis was affecting me in these different ways. But when I think about it now and see it on paper, I understand how it does. It really helps us to start a dialogue, and it helps us to identify what's important to one patient versus another patient.